Hi, how are you doing? My name is Shellie Willis. Thank you all for joining us. My name is Shellie Willis. We love it when we're streaming live on Zoom because it just pops up. I guess this is a really good day. So, first of all, I just want to say thank you, ladies, for joining me. Thank you so much for joining me. And right now, while I'm talking, these ladies are going to be going over and starting their watch parties and getting everything together so that they can ensure that their audiences know. And so, first of all, let me tell you why you're here. My name is Shellie Willis. I am a 24-year Army veteran. And if you don't know me already, you might know me in multiple spaces. But today, one of many crucial conversation series that I've started, this is my way of bringing conversations, out in the open, having a roundtable, great in-depth discussions with a crucial conversation, on deck, meaning that as a way to advocate for Final Salute Inc. as a finalist for Miss Veteran America, whose mission is to provide safe and suitable housing for homeless women, veterans, and their children. Final Salute Inc. has been around since 2010, and its founder, Major Jazz Booth, found herself subsequently after being a cancer survivor and separating from the military. She found herself and her son homeless. And so, as she was going through trying to find resources and services and support, she realized that there was something that was missing, and that was not only assistance for women who are in that situation, homeless situation, but also women veterans. There was something missing. So, if you know me, I always say we find a need and we fill it, and that is exactly what she did. She wanted to create something that would help address the unique needs of our homeless women veterans. And so now here we are in 2012. She also launched the Miss Veteran America competition. It is not a pageant, it is a competition. And it is all about showing the wonder of the woman beyond the uniform. Not that we are just sailors, soldiers, airmen, Marines, Coast Guardsmen, but we are also your mothers, your sisters, your wives, your daughters. We're your neighbor. We're serving on your PTAs. We are more than just the uniforms that we have worn. We are doing all of this through grace, poise, beauty, and service. And so we are here. I am here. And this is my way in this COVID moment to find unique ways to advocate and have crucial conversations around not just the factors, but just also solutions to some of those. And I've got with me today some wonderful professionals. Ladies, have you been able to start your watch parties? Have you been able to get started?
I think so.
Okay,
I
so go
never did
into
a rock party, so I don't know what I'm doing, but
yeah, you can share it, and when you share it, so when you click on it, you can share it. And I'm looking at it now, so you can share it, and you can click share, and you can start a watch party, or you can copy the link. So one way or the
okay.
other, you can either do that or copy the link. It's in the discussion portion of the event. So when you share,
Okay.
make sure you lower your volume so we can get started. So we've got plenty of time for everyone to be able to walk us through your own life's journey. We're going to go over some specific areas, conversations around working in the community, your body of work that you have done as a professional, whether you served or not. And as someone who is supporting and really moving the work forward, we want to make sure that not only is this conversation getting started, it's going to continue. So I'll be doing crucial conversations for a minute. This is going to be a new series where I can bring great and wonderful texture and context to the table, so we can have those conversations. And of course, I love a good hard conversation anyway. And if this is a way for us to advocate for our homeless women veterans, our veteran community, how do we take the word homelessness from in front of it,
Yeah.
And so where we can just say women veterans, where we can just say veterans, where we can really eradicate and erase something that is really almost like a disease, something that is
Yeah.
almost, it's fatal. It can take us out. And especially
hmm
now in this COVID moment, ladies, where now more than ever, we have all kinds of opportunity to really do some work, not just on ourselves, you know, and I know we're going to get into this, but also in our communities with one another.
Sure.
How do we show up
Mhm.
better so that we don't have to do that? I'll be talking about the fact of many things, programs that Final Salute Inc. has and things that they're doing, and why, as an ambassador going forward from this moment, as an ambassador for this organization and for women veterans everywhere, being able to talk very succinctly and very clearly about the challenges that we face and the resources that are available to assist us. And then we're in our own backyard. So let's get started. I have today with me Miss Trelease Hartfield. I have Deb, I'm not gonna call you Deborah, Langheld, and I have the wonderful Tracy Jones. So ladies, I'm gonna start with you, Deb. Give us a brief introduction about who you are, and we'll move on from there to Trelease and then to Tracy, and then we'll start going into like the body of work and how you got here.
Okay, my name is Deb Langheld, and I am a 47-year-old woman, and I am currently a student. I'm midlife career change, and I'm a naturopathic doctor student and a master's in public health student. I'm about 10 months away from graduating with both a dual degree. Before that, I was a mechanical design engineer and program manager, and living on the East Coast before. Now I'm living on the West Coast and going to Bastyr University, and that's my background.
I love your it's almost like midlife crisis.
Midlife career change.
Midlife career change, I love it. Okay, Trelease.
Well, I can definitely speak on midlife career change because I did the same thing. I'm a veteran from the Army, and while in the Army, I love obviously being the person that sit and listen to everyone. And once I got out, I did a little bit of working with soldiers when they got out the military on a medical discharge. So at that time, I loved to sit and talk. And at that time, I said, I have been doing my job about 25 years. Do I really want to switch now? Yeah, I did. So here I am. 2 masters later, enjoying life as I am now, being able to serve again with helping, the community. And I'm here for all the crucial conversations, always.
Amazing, amazing. Thank you. So Tracy, talk to us. I hear you have your coworkers in the back.
Yeah, I'm so sorry.
Look, this is a real look. This isn't a faux conversation. We didn't stage anything. We need the people to understand and know this is real life right now.
This is real life, yeah.
Some of us have coworkers in our homes while we're trying to be great.
Thank you for that, Grace, Shellie. I so appreciate it. I have been doing this work for about 30 years. I started right after college, working in domestic violence. Moved on to drug and alcohol treatment for young adults. Most of them were court ordered. They were in gangs or generational substance use disorder families. And then about 25 years ago, I moved here to Seattle and started working exclusively with the homeless community, and was with an amazing organization, Compass Housing Alliance, for 20 years. And during that time, I became the director of veteran services there because veterans have always been a passion of mine. I can't thank you all enough for what you've given up to serve our country. You don't get paid well. You don't get treated well sometimes. So I wanted to make sure that after our men and women are done serving our country, that I get to serve them and get them the benefits they deserve and they need. And especially with women veterans who most of the time don't even consider themselves veterans.
Yeah.
Thank you so much for that.
Yeah.
Man, look at this amazing panel of wonderful professionals, wonderful women of wonder who are doing such great work. And I am so honored that you are joining me in doing this work and having this conversation. So let's get down to it, ladies. Final Salute Inc. .org, on their website, finalsaluteinc.org, they talk about the multiple factors that actually lead to or contribute to homelessness. And when you're thinking about your journey, it's to your why. I would love to know, and mental health is one of those. As a matter of fact, mental health is, it doesn't, I think I said in a post, it's not just mental health, it's what were the triggers to get you there. And then from there, it could possibly be a lack of support, a downhill spiral from there. And you know, as a woman, we tend to be, I always say we're probably more prideful than men could ever be. We will protect our young, we will scrap, we will scrub, we will do whatever we have to do. And sometimes that also means that we may not ask for the help that we need, right? And if we are assaulted in any way, hence one of our current epidemics, which is military sexual trauma coming to light, all of that all of that is connected. And you know, let me know if I'm off the path, but all of that impacts your mental and your emotional, right? So let's talk about, I'm gonna go to Deb. I'll start with Deb again, and just talk to me about, like, what drew you to this work in this space of working in this space right here?
Well, I guess it's been a long journey. I served in the Navy for only 3 years when I was very young. So 30 years ago was my 3 years. So it's been a long time ago since I served in the Navy. And then after that, I became an engineer, working for all kinds of companies, doing Department of Defense and other companies all around the Washington, D.C. area. So I had a lot of interfacing with the military, even though I was a civilian for my whole career. And I saw a need in my fellow colleagues, my engineers and the machine shop and the people that I worked with. We would work really hard to support, in many cases, support our troops, but from behind the scenes, as designing things that they needed and getting the products to them in a timely manner where they would be useful. But these people behind the scenes, these engineers would sacrifice their health to do what they needed to do. And this is not just, civilians. I mean, this happens in the military too. We sacrifice our health, especially women, as you mentioned, Shellie. We will do whatever it takes, to support our young or whatever it is. And so that's what I saw happening. And then people were dying young, like, several of our machinists driving to work in their early 40s just dropped dead of a heart attack because they were spent, And so I was like, wow, we're not healthy. We would bribe people with pizza to stay and work through lunch, and bribe them with pizza to stay and work through dinner, and 12-hour days. And it wasn't working for people. It's not a balanced lifestyle. And this all applies to women vets as well, especially, when they get out of the military. They don't know how to cook for themselves and grocery shopping, especially if they've been in for many years. They're used to the chow hall or whatever. So there's a lot of parallels, but that's what drew me to this work. Was I'm like, okay, my hobby is natural health. It was a hobby. Now it's going to be a career. And I decided I'm going to quit, mechanical engineering and program management and go into natural health and empower people on how to create a balanced lifestyle, not just nutrition, but mental health, all aspects of health. That's why I'm going to naturopathic doctor school. So.
Wow, man, that's true. We got a comment, Brenda Roche, I want to say, she said, women and mothers think they have to do everything for everyone, ignoring our own needs until breakdown. Oh my goodness, that's so powerful. So Tracy, talk to us about your why, and then we'll go straight to Trelease.
Oof, my why. I feel like I didn't really have a choice. I had a calling, and that my calling was to help people who are less fortunate than myself and who have come from circumstances that are less fortunate than my own. I myself am a sexual assault survivor from a childhood. So I know what that does to people, right? Especially women, right? We're supposed to just brush it off and keep on going, right? Even though we get blamed for it, or we're said it was no big deal, all of that, right? So I started out in domestic violence and working with women in a shelter who ran from abuse. Mm-hmm. And then as my career went on, when I started working with veterans, I saw that nearly all the women veterans that I worked with had some sort of sexual assault prior to military, in military, sexual harassment,
Wow.
full-on sexual assaults, et cetera, et cetera. So I know that their voices need to be lifted up, and the VA needs to hear that women count and that we work just as hard, if not harder, than men do while we're in service.
Wow.
And that we need to be protected in military and then honored after.
Amazing. Yes. And those are all facts. Very,
Yeah.
very true. And if you don't know, there are an estimated 55,000 homeless women veterans right now. And I'm sure that number has increased in this COVID moment. So this call to action, this level of advocacy, this conversation, this crucial conversation is going to hopefully drive the narrative forward and move the mission of Final Salute Inc. even further down, even further forward, and let that be heard. So Trelease, what is your why? Talk to us.
Well, like I said, I started out working with the veterans, and when they were getting out the military, the kind of care they were receiving when they were getting out was kind of like, okay, you're a veteran, now I got to fight for my benefits, I got to go through all of these types of things. And I kind of said, okay, I need to figure out how I can kind of help in this department. So I said, I love mental health and I love listening and talking to people. So here I am, right? So my main reason of why is I think after doing this job for about 12 years, I feel that a lot of things start at home when they're a child. Okay?
Wow.
Number one reason out of everything I've dealt with, conversations I've had with kids, parents, couples, whoever, it always starts at home, even if it's with the child now or if it's with someone that's 60 now, And so for me, my why was I really want to reach the kids. Being that my mom was a teacher my whole life, all I know is kids everywhere, and being the one that, is aware that teaches them or tries to guide them to go in the correct way. So for me, working with the kids, I think causes a better atmosphere for everyone, because sometimes you have parents who are uncomfortable talking to the kids because they were never talked to either. So they have no idea of what to say to the kids. So for me, my why is to try to reach the children. And I've been successful in doing that. And I am very, very, very happy that the conversation is still there. I've been trying to preach mental awareness for a long, long time. So I am so excited about this. So excited.
So what we know, and to Tracy's point, when we transition out of the military, we know that there are new programs being set up, the Women Veteran Transition Training Program that the VA has set up. But we also know that through studies, 82 to maybe 87% of women veterans transition, they do not access their VA health benefits. And so I would love to know from you all, anyone can jump in. Why do you think that is? What are some of the challenges that you've heard or things that you've seen as to why, we've had to create a program, but if it's not mandatory, it's not happening. You know that. So how do we change that? How do we lower that number and get more women to access VA services? I'm just going to throw out one of the words is trust.
Correct.
Everybody jump in. Just jump in and let's have a conversation.
I think trust is like the number one factor, because that's the first thing we learned growing up, trust our parents, trust everything that's going on. And then once it's broken, it's kind of hard to get it back. So then when you're in the military, you trusted everybody, all these things have happened, you get out, you're supposed to have support, you're supposed to have all these things that's here for you, but now there's nothing, just like you spoken earlier about military sexual trauma, like a lot of people never really talked about that, so now it's awesome that the word is coming out. I hate that it had to come out this way, but sometimes things have to happen for a reason. And I feel that having these crucial conversations is going to be the best thing for us to be able to combat this kind of stuff.
We got a comment, y'all. And if you all get comments on your watch parties, if people are asking questions, please make sure you just say, hey, I got one. We have Brenda also said veteran women often feel so isolated they don't know who to ask for help, are embarrassed to ask, or are just overwhelmed with kids, work, and other commitments. And that's if we are even in the situation to have kids work, work and other commitments. That is a challenge in and of itself. So what do you all have to, what say ye around the things that you've seen, challenges?
If I can speak, one of the best things that our VA in Puget Sound did was make a separate entrance for women to go into the women's clinic. Because you're expecting women who more than likely were sexually assaulted or had sexual harassment while in the military to then walk into a huge government structure that is filled with all men.
Yeah.
And I can't even tell you the number of times the female veterans I worked with who had mental health issues and who had some severe trauma said, I can't do that. I can't do that.
Well, along the same lines, Tracy, I think that this is why telehealth and telemedicine is so critical, because there's a huge place for it in our women's vet community, because it offers two big solutions to some problems I see with women vets. Is if the VA would allow women access to telemedicine, they don't, because a lot of them are homeschooling their kids. They can't just leave now with COVID to go all the way to the military base for military medical or whatever. And mental health things as well. It's hard to, they're seeing a psychiatrist or something who is an officer and they have to say sir in between sir sandwiches. They're trying to, and they don't feel like they can open up. And if they could actually access healthcare off the base, and via telemedicine especially, it would, I think, allow them to open up more, feel more comfortable. They're in the comfort of their own home. And it might open that doorway a little bit to allow them to start taking care of themselves when they, in a way that works for their lifestyle.
Brilliant.
That's for sure. And I mean, I can speak a little about that, because a lot of clients I have now, they love the idea that they can use telehealth, because they're like, finally, it's there. But, a lot of people don't realize this kind of stuff is there, and it always has been there. But now, of course, the attention is there. And again, the way that we're going to have to combat this stuff is, again, communication. We got to talk about it.
Absolutely. And the unfortunate bit is that most of the women that I serve are homeless, right?
Yes.
So telehealth is not easy at all.
Yes.
Luckily, our office is setting up computers, private iPads in rooms so people can do some telehealth. But I
want to talk about that, because if you're seeing a mental health professional and you don't have access to technology, I couldn't imagine not being able to have a conversation with my therapist. I couldn't imagine not being able to reach out to someone and reconnect, and not feel as though I am like my back is against the wall. I don't have a way to really get connected to anybody. Everything just got cut off.
Yeah, that happened a lot. And that's another reason why I want to kind of move into mobile counseling. Yeah. Because of people in that situation, they can't get there. But I want to be in an area where I'm set up in this area, and you guys, I don't care if it takes you a mile to get there, at least you can get there. I'm becoming accessible to you. So I think that sometimes the access to care is hard. And for them to even try to get there, especially now during COVID, there's no public transportation. There's no way for them to even get to do anything. So, I mean, all of those things are kind of hard on the mental.
Yeah.
Tracy, you've worked, both of you two, Trelease and Tracy, have worked with homeless, I'm sure, more than I have. My only real experience working with homeless people and women is I worked for an organization called the Integrated Care Outreach, which is just a small, tiny little volunteer organization of mainly best year students, but we have some UW and some other medical students, along with a handful of doctors, 3 or 4 doctors, and we go to the YWCA in Seattle, and every other Sunday we would open a little mobile clinic, Trelease, just like you're talking about. We would bring all our own medical equipment, and we had a little closet that they allowed us to put some other equipment to. And we would set up little dividers, and see patients,
Brilliant.
they didn't have to travel
Brilliant.
anywhere. They just had to come down the stairs from.
Brilliant.
And that was work, but I was surprised how little it was used, because like there were so many people, so many women there who could have taken advantage of it, but I don't know if we didn't advertise it well enough. I mean, I'm curious what you think about it. What do you think would make something like that be more effective?
Wow.
Trust and word of mouth. Trust and word of mouth.
The word of mouth is exactly how we got the patients that we did see were all word of mouth, right?
Yes.
And it was interesting. So the trust was a big player in that. You're right.
Relationship, because you had to connect with at least one, Deb. At least one.
Yes.
And that one. And I always said the best form of marketing is here.
Yeah,
Right?
That's right.
My
That's right.
experience that I have. I know that we are on, I don't know if you all are on, and Tracy, maybe you've heard like on some of the Center for Women Veteran platforms, and when they have live broadcast or when they're sharing stories and things like that. And I've been on some public forums where they've called in from DC and just wanting to hear some of the challenges from around the country around what women, there are a lot of women who have had some very, hard, very bad, still today experiences. Unfortunately, every VA is not created equal, right? And I can say, like, what I love about here at the American Lake VA here has been I love the fact that the Women's Health Clinic is separate from the hospital. So it felt, I know that I'm going in, but I feel like I'm going into a boutique, receiving a suite of services. Even the mental health is right there in that building. So I'm either going to see a mental health counselor, or I'm going to see my doctor, who is very hands-on and focused and working with me. So, but I can clearly understand when I'm hearing my other sisters talk about their experiences with the VA. But I would, I love if they create a different entryway, if they create a separate access point, if they make the women feel as though when you come here to access your mental health, your medical, everything, we know that you're special enough to have your own entrance. We know that this can be overwhelming, I don't want to be around all of that when I walk into the hospital. I was overwhelmed going into the Seattle VA.
Even at the ICO, we didn't wear white coats because we wanted to remove the white coat syndrome.
Right.
It's similar to what you're talking about. So exactly what you're saying.
Wow.
Yeah, I think you guys have all hit on something, that women are relational, right? We are relational. We have to connect in order to trust and to know that you are going to have my back. We can't go into a situation blind a lot of our time and go, okay, I'm just going to lay everything out on the table for you. And that's in general. Even our trans sisters who are veterans, it's the same thing. We're all relational. So I thank you for bringing that up. That's important for us.
And not having the opportunity or the breadth and the depth to be able to say, this is for you. And at the end of the day, I have to tell you, I went ahead and started using the VA for their services when I realized I needed to start walking the talk. I needed to be a part of the solution and not the problem, right? And I won't even say the problem, but I just needed to be a standing bearer or someone who is sharing their own experiences. So let's try this VA thing. Let's see if this is really the experience that people are having. Let's, hopefully, and pray that I don't. I can honestly say one negative thing to say about so far over the last, 3 years, I think that I've been going. I've only had one negative experience, but other than that, overall, it's been very positive, very, very positive. Go ahead.
Can I ask why it took you so long to get there, Shellie? And I don't know if
the stories, everything that I heard about the VA was negative.
And
I don't know. Yeah, everything was negative. And I mean, even trying to find like a mental health counselor that would, you know, I already have a couple of strikes against me. Not only I'm a woman, I'm a Black woman.
Yeah.
So, you know, dealing with the stigma of how the medical professionals deal with Black women and how we connect and how we talk about our pain levels and being, you know, it just blows my mind. And so
Yeah.
I was still going on JBLM. I was still going to.
Oh, wow.
I was, but I made a conscious decision to just, okay, you can't be out here advocating and not actually going through and experiencing it. And even though my experience is not everyone else's experience, I can at least speak for how I get treated where I am. And so what I started immediately doing was saying, you guys need to get registered so that you can start getting the support and get your benefits. Start accessing your benefits. Now, Deb said something earlier, and I think we all touched on it. I work in the space of transition employment, right? I deal with a lot of different demographics, but specifically around the creating and or work around the military initiatives we have here in Washington State. One of the things that really kind of breaks me is when the way we treat our service members who separate. So understand the difference between separatees, people who are just separating from service, and the way they transition out, and versus people who retire, right?
Yeah.
And going through my retirement, I had to go through the VA process. I had to go through the retirement physical and all of that. But people who are just ETSing, separating from service. All right. I also have learned over the last 7 going on 8 years since retirement that all branches of military do not treat separation from service the same equally.
They don't.
And if you're not, you know, so how do you get and access those benefits? And as women, we don't realize, you know we don't have, for some reason or another, we don't know where to go to receive services, or the sea of goodwill could be so vast that we don't know where to start. The sea of goodwill could be so vast that we don't know where to start, right? And in trying to be able to really wrap our heads around where do we start, but then again, what's for me, which is the biggest issue. You know, if you look at the studies that are around the grant per diem programs, a lot of these shelters and that have to receive this funding from the grant per diem program, you know, at least 6 out of 10 of them were rated that's not safe for women, especially women with children.
Yes.
Right? How do you create transitional housing programs that will you know, help me to become mentally and financially and physically stable?
Yep. If I can jump in about the GPD, I ran a GPD facility at Compass Housing Alliance, and we had the women's wing separate from everybody, across from the staff office, with their own kitchen and a door that would close.
Okay.
So we knew that women were not necessarily going to feel safe in a community of mainly men unless we made sure that they felt safe.
Right.
That was our first important bit. And I actually remember the Inspector General speaking about that and how so many other facilities were not protecting women who were in those.
Wow.
I guess that's what the YWCA's program is for women homeless, homeless women, which provides a pretty large building for this transitional housing that gets them back on their feet and tries to provide services to help them find jobs and that kind of thing. But we need something like similar, I guess, for our women vets who have really unique needs.
Yes.
I think there's a bunch of things, like I said before, they haven't, a lot of times, depending on when they're separating or retiring, they really don't know how to, cook or grocery shop. And there's all kinds of, I think, opportunities and focus on their women vets' unique needs. So.
I mean, it's got to shock some people. What do you mean she don't know how to cook? What do you mean? It's not just the women, it's the men and the women, because we come from a culture that it creates structure for us. And so, I mean, everybody isn't like that. That's not a lived experience, but we also have to understand and know that everybody's journey in the military, these are people. We are human beings. Before we joined the military, we are people. We are human beings. And so when you don't humanize someone and you just look at them and recognize them for what they wear, what they're doing. So, that's why it's so huge to be able to say, we need you to relate to us. We are your mothers, we're your sisters, your wives, your daughters, we're your best friends. We need you to relate to us, because as long as there's that stigma of the uniform and how great that is, and we all don't have the same experience. I had a great experience. That may not be everybody's story.
Right.
And some people may not want to relive that time, right? Right. They may not want to. And so when you start asking, and we're out here doing the homeless point in time count. Have any of you participated in the homeless point in time count?
Yes.
When you were asking if you were a veteran so that you could kind of get those demographic numbers, what were some of the challenges that you found participating in the homeless point in time count?
Well, one, people would ask women if they're veterans instead of, did you serve in the US military? So we changed that up, because a lot of women don't consider themselves veterans because they weren't in war. And a lot of the time, people did not want to even address that they're veterans or ever served while we were asking them. So our count numbers were really low in King County. I did the count for 12 years or so. And most of it was walking outside and, counting people in cars and what have you. But it was so not the true number in King County, because they didn't know how to ask people and people didn't trust them.
Wow.
Especially our women veterans.
Our women.
Yep.
So what about you, Deb or Trelease?
Well, for me, I always like to advertise my women veteran status.
That's
so
right.
I love when I see on the back of the car when it says, I'm the veteran, not him, type of thing. So, anytime I didn't get to participate in the study that you guys are talking about, but I could definitely see how what Tracy says, how people would, not want to really trust what's going to come from what I say, when I do tell you, the answer. So, I mean, I've never been doing. Did you get involved in that, Deborah?
No.
Yeah.
I do. I understand what Tracy's talking about, though, because, I served for 3 years when I was very young, 17, 18, and 19 years old, 30 years ago. And I don't consider, I would never really call myself a vet, even though technically I am, because I went to the Naval Academy and I was active duty, and I looked up the rules. I am considered a vet, but I was never in the fleet. So I don't like to advertise it because I never was in the fleet. And so, and there was many reasons why I left, but it's not something I usually like to talk about because it's sort of not, it's misleading to say that I'm a vet. I wouldn't compare myself to any of you guys. So Tracy, that would be like me, like I'm not that.
Yeah.
So. But I do understand the military a lot because I worked with very, very closely hand in hand with military people my whole career, supporting them in the background. So I'm still proud of what I've done, but and I have an appreciation for all our services quite a lot. So, but I did wear a uniform. And
when we talk about when you're thinking about the balance for our mental health, it's mental, it's mental, it's physical, it's spiritual, it's all of that. Deb, we had a nice side conversation. We didn't get to go into depth, but before we go any further, as far as I'm concerned, sister, you're a veteran. You served too.
Yes, ma'am.
I don't care about any of that stuff that's written. If you wore that uniform for 3 minutes, 3 days,
that's right.
Yeah. Veteran. So I want you to own and embrace that for as much as you can in your time. But I need you to know that and hear that from me. There was 3 years where you held down a spot. You did something specific. Yeah. If you weren't there, it would not have happened. So
that's right.
We got it. So how are, when we're talking about it, and mental health encompasses so many things. So let's talk about maybe there's some triggers or some things that may have how do we become healthy? We've been talking a lot about the challenges, and we've been talking around a lot about like things that lead to X, Y, and or Z. But how do we talk about some possible solutions or some things that you've tried in your own fields of study that you know may be proven that have worked?
I think there are a lot of opportunities. All of you ladies have really hit on a lot of the fundamental core concepts like trust. But from my research and experience of how limited it is, even with vets, a lot of times vets, and especially women, don't want to open up to the medical base psychiatrist. That's really like not something, or psychologist. They don't want to talk to them, and they feel intimidated for whatever reason. There's they're an officer, or who knows, but it's not something, so they don't use it, and they won't use it. And that's in writing. I found several published studies talking about that. So then you have to ask, well, where would they feel comfortable opening up to address, their mental health? And that's why I'm really a proponent, I think, of telemedicine and giving them access to healthcare outside of the base. I think that's really the key. And now with COVID, things are opening up. Like, I at my the Bastille clinic, which is through the university, my ND program. I'm surprised. We have transitioned to over half virtual shifts. So I do clinic. Yesterday I had 8 hours of Zoom patient clinic shifts.
Wow.
And and I do also a mind body medicine shift. So we are a naturopathic clinic. So we focus on the core fundamentals of health. That includes mental health in all of our visits. So it's nutrition and strong social connections and good food, good water, a healthy environment, home environment. And healthy means no domestic violence. Or do you feel safe where you're living? Do you have the support you need to take care of your children? All of these things are addressed in every visit at Bastille, regardless of whether you're going to a mind-body medicine shift or not. But the mind-body medicine shifts are fantastic because we focus on resiliency. How do we help our patients?
Resilience.
Right. Good word.
That's a big word.
And so, we need patience right now because people aren't used to coming to the Bastille clinic virtually, but anybody can call the number and schedule a shift, and you'll get a whole team of people, of students dying to help you. And it's funny, I've learned through these shifts that I've been doing since COVID began, that it's funny. I think people really love all the attention. Like, they feel alone. Some of these people are older women and they're very, very isolated. They don't have surrounded by people. So they are truly isolated. And so having a whole team of student clinicians asking about, and we'll spend an hour and a half sometimes, because if we have no other patients, so there's a huge opportunity that's not being taken advantage of right now. And so why would our women that's not use it? And I think it's simply because they don't know. And then there's the trust. So,
well, hopefully they know now. And I think what's really important and what's really big is that you can share, if you can share that information out, then we would be able to push that out as well for especially any of our women veterans who really would like to connect with a clinician and really get to the root of, having a conversation with someone so that they can have an outlet. And you brought up something really clear, really important, was that the isolation. People instantly had to shut down and they couldn't see friends, they couldn't see family, things like that. I was just asked, I see in the chat, Mary Captain asked that you please provide the number to the clinic, Bastille. Not sure of the correct spelling, but yes, you're right. You were on it. So we are going to provide that information. Okay, so let's keep going. Deb kicked it off. Let's keep going. I don't want to stop.
Well, I think a big game changer for most of us who work with veterans who are currently homeless is trauma-informed care. Trauma-informed care. I'm going to say it again. Trauma-informed care is understanding that the brain maps itself once women have trauma. So our reactions, the way that we interact with the world, the way that we interact with people who are in positions of power are all because of the trauma that occurred with us when we were children or even later while you were in the military. It changes completely. So understanding that and honoring that and knowing that women are doing the best they can. And I love the resilience comment, Deb.
Yeah, a resilience, perfect word.
Yeah, it's interesting because we had to do a lot of changes in how we do medicine to convert it to virtual, right? And so normally when we at the Bastyr Clinic anyway, the mind body medicine shift, we use a combination of tools, but some of them are biofeedback equipment, where we actually teach people how to breathe to activate their parasympathetic nervous system. So we can even help them talk about an event that normally would trigger a sympathetic response, meaning a fight or flight response. And then we teach them how to actually control it immediately, and they can see it, their response, their physiological response. It's quite interesting. Through respiration, we have respiration belts, and we have earlobe sensors that help them learn how to control heart rate variability and all kinds of things. Now, we couldn't use a lot of this equipment virtually, so we created a resiliency program on the Mind Body Medicine Shift where we still teach them the same things, but without the equipment, which in some ways is a huge advantage because most people aren't going to go out and buy all this equipment anyway. And it's perfect for women vets who are homeschooling. They need to be able to do this at home. They don't want to be spending bring it all the way to Seattle or whatever. So the program's actually, I think, one of the silver linings to all of the COVID stuff that's happened is we've had to recreate and redefine, how we provide our medicine to people. And, honestly, I would recommend that, going to the virtual clinics at Bastyr for anything. It's fun. They're fun, and you always learn something about botanical medicine or something new about food that you could be eating to help whatever issue you might be having. And so they're fun shifts for everyone, and they're not like a going to see an MD doctor. We have a different focus, And so anyway, the number though, real quick, is for the Bastyr Center for Natural Health, and you can call them and schedule a virtual shift. Is area code 206-834-4100. And if you wanted specifically a mental health type shift, we have counseling shifts, but we also have mind body medicine shifts, and you would have to request those. Otherwise, you would just do a regular one. But anyway, this is not an advertisement for Bastyr. It's just an option.
Well, too late.
It's important.
Yes, it is, because the pivots. And so we'll get to the pivots in a minute. So go ahead, Trelease. I don't want to stop. I know you're thinking. It looks like you're about to burst.
My brain is only because, you guys, the main thing is people feel that you got to have a mental illness to get your mental health checked out.
Yes.
And you don't. It's like, just
I love the mind body
just because you're overwhelmed during the week, you can still talk to someone.
All of us do it. It's so much fun.
It's like, just call somebody and say, you know what, I just think I need to talk to somebody about, how you talk to your friends, and they were like, girl, I got to go. The same way. That's the way you do it. You just have to sometimes find out through your friends, even just the conversations, because you never know who all is using those conversations. Mental health is just about mental health.
Strong social connections are a big component.
Yes. Oh my gosh. And so, people were worried. They were like, check on your extrovert friends. They are not okay.
Because your happy friends are not okay. That is correct.
Like PTSD, the military, just so everybody knows, the military community does not own PTSD.
Yes.
No.
Or PTS. They don't own it.
No.
It was, it's not just that community. That is not even the largest percentage of sufferers from PTSD at all. That is
but
not.
Go ahead.
Go ahead.
I was going to say the thing in my experience from the people that come to me, the PTSD started in the military though. Yes. And then now other things are happening and it's making it, come back. And then they go back and they're like, well, you know what? I never thought about that. And it's like,
triggers. They happen.
Triggers. That's a magic word, Shellie. Triggers.
Because there are things, we suppress things that happen to us traumatically when we're young. And just for fun, I'm not a mental health professional, but I can tell you that my own mental health journey, is, seeking help. I was able to do, when I did my TED Talk, I told Trelease, I said, go watch my TED Talk on my website, go watch my TED Talk. And I tell my story. And you're like, no, not you. Mental health does not have a poster child.
No,
That's right. That's right.
Mental health does not have a poster child face. Like, there's no one example of what a person looks like. But seeking help for when you find out that you're having these triggers, when you see yourself struggling, when you see yourself going through things, because then that starts the downward spiral that can lead you into, homelessness, or they can lead you into whatever that, or they can keep you in a bad situation, like a domestic violence situation. There, right? Because do you become mentally, do you mental paralysis? You start to,
that's just what you're used to. You just get used to that. Yeah.
It's true.
I do want to, though.
I think many feel trapped, though. They feel like they don't have any other place to go. And
right.
So if they had a place to go that felt safe, then I think that, more women potentially would be willing to exit a domestic violence, situation.
Yeah, things have gotten better a lot now, over the years, because of all the technology we have. But in the past, it definitely wasn't as well known as it is now. So that's the one thing I can say. Technologically, eventually things are going to get more and more, I think. And we just have to stay on it, though. We can't stop talking about it.
Yeah. Tracy, what were you about to say?
I should tell you guys, Washington State Department of Veterans Affairs, WDVA, has a counseling program. So we have counselors all around King County for free. For free.
That's awesome.
And I love the work that our Washington Department of Veteran Affairs is doing. I love the level of intentional work that they are doing here. But if you're watching this, you live in another state, connect with your state VA rep and see
I
our
don't live in Washington,
veteran
so
service
I'm not
organizations. So we have 10 more minutes. Well, actually, we have 8 more minutes. This is really good.
Tracy, what's the number that like a woman vet could call if she wanted to
find out?
Yes, there is a number. I know the Women's Health Clinic has one. Tracy, if you can find it. I know our Women's Health Clinic here in Washington State, they do have a hotline for mental health as well as for medical appointments. They have a whole separate thing. You don't have to go through the operator line, as far as I know.
Thank you for mentioning that, Tracy. I think that could help a lot of people.
I can't believe
put that in the if you can put that in the chat, we can share that out as well, and get that information out. So we have about 8 minutes left, ladies. This is an all-out assault. We are the mark, and what we do want to make sure that we do is we want to make sure we leave the people with something to think about. So the whole point of having a crucial conversation is not only to talk about whatever that conversation is about, to also delve into the solutions that could possibly resolve. In this COVID moment, many of you, all 3 of you, have talked about how you had to pivot your service delivery. And one of the things we talk about when we're dealing with unemployment, we know about the people who have access to technology. We know about the people who can do, who we can reach. But what about the people we can't reach? What are some alternative methods that have been created to reach those who may not necessarily have access to that? Because even though we want to create access, it's not altogether equitable. And so we're trying to really get in the trenches and reach our homeless veterans, our homeless women veteran populations, and they may not necessarily, I know a lot of them have phones. So like, what are some other unique things that you're doing? And then we're gonna wrap up. Leave us with some nuggets, some things to think about before we wrap up. And I'll start with you, Tracy, and we'll just work our way back.
Some of the unique stuff that we're doing during the time of COVID. Oh boy. Our offices are still open in downtown Seattle. So our veterans who don't have phones can come on in. We have our computer lab open so they can contact their the VA and their doctors. We also have iPads set up for individual appointments that they can talk to their social worker through King County Veterans Program or their providers at the VA. And we try to be as safe as possible, and we still do some outreach to our veterans who are without housing.
All right. Thank you so much. Thank
Thank
you so
you.
much. Okay, Deb, what do you have?
So your question is, something to think about for them to think
Something,
about.
yeah. So how are you, what are some unique things or something that you've had to do for those individuals who may not have that type of access that we talked about earlier, access
Well, I
to
guess,
internet and things? And then
yeah.
what's something to leave on the minds of people to think about?
I would recommend to our women vets out there to, if they feel like, they need some help, to don't be afraid to reach out and to look for it. If it takes a little time, go to a library and use a computer to find the numbers to call, because there's a lot out there actually. Like even now, I don't know how far away our women vets are from the YWCA in Seattle, but go there every other Sunday, get free medical care. I mean, it's not, you don't even have to be a vet, you can just be a woman.
Yeah.
You just walk in. We don't say no to anyone, and we have supplements that we give. It costs nothing.
Wow.
You can make a lot of contacts there. So even if you just go and talk to someone and meet some interesting people, we do acupuncture and massage free at the ICO. So integrated care outreach, which is at the YWCA every other Sunday for homeless women. And so, but we don't ask, where's your credential that you're homeless? We don't ask for credentials, right? We don't say, do you live?
So they don't have to be afraid that they have to actually prove.
No,
Right.
you just have to walk
I'm
in and
homeless.
put your name on the little thing, and then we take you. So, and we love it because we get to meet new people and we get to talk to the women and find out what their needs are. And if we don't have the answer, we usually can go find the answer for them. And so I've seen women who were victims of domestic violence, and I've talked to them about their needs and all kinds of things. And there's a lot of resources out there that are just waiting for you to take, and it's there. So I would say, and if it's not there, don't be afraid to ask for what you need, because there's people who want to find it for you and get it for you.
Yes, and I'm asking Eve because I want to make sure, McKinney-Vento, the guidelines around what justifies or what defines a person as being homeless. And I know that conversation around, you're not asking for credentials, but then there may be some other organizations that are. How do we just because they have funding, so they have to verify it. There's just so many steps. So how do we remove all of that? So Trelease, I want to get
the integrated care outreach. You just walk right in. It's downstairs, right at the YWCA.
Well, y'all heard that. So what, Trelease, where are you and what is offered where you're at? Because I know you're not in Washington State.
No, I'm actually licensed in Maryland, and I know here we have a lot of psychiatric rehabilitation programs, and I don't know if you guys have ever heard of those, but they deal a lot with helping the homeless. And long as you have to have Medicaid, and you don't have to pay for anything. So look for those psychiatric. The nickname is PRP. Just ask some of your friends about PRP programs. Those are things that they help with those daily activities that you may need with. And another thing that I specifically do is you can make on your business card, put your information on there. Hey, this is what, come talk to me. We can have a conversation about anything.
Brilliant.
Things that you can put into people's hands is the way I think that's the quickest way for us to actually get it to them.
I agree. So I invite all of our watchers can, friend me on Facebook and ask me questions,
Yeah.
Okay, well, they just opened up the floodgates, I don't know if Tracy did, but Deb and Trelease definitely did. You can connect with them. So we are less than 2 minutes out. First of all, I want to say thank you, ladies. Thank you. Thank you so much. Thank you to my green screen for falling down, but we had to recover.
Thank you.
Thank you for joining me. I know that I'll be reaching out for you again. So for those of you who are watching, this is one of several series of crucial conversations that I am going to have as an MVA finalist, but also beyond. Crucial conversations are all about talking about the hard stuff, but also finding solutions and really giving you something to think about so that you can carry the mission forward, so that you can carry the thought forward and you can continue to pay it forward and speak about it. So I thank you for joining me on on my journey as a finalist for Miss Veteran America. And I want you all to know, if you want to know more about what Final Salute Inc. does, you can visit finalsaluteinc.org. If you want to know more about the Miss Veteran America competition, you can visit missveteranamerica.org. And you can also learn about all of the great work that they've been doing, how many women veterans and their children they have provided support and services to, as well as know that Final Salute Inc. has helped women in over 30 states and territories, so they can reach you where you are. No, they are not accepting new people into their transitional home. They're located in the DC, Maryland area as well, but they are able to assist you if you need financial assistance for being behind on your utilities or rental assistance, things like that. So please go and visit their website, find out about this great organization, find out why someone like you might want to and need to compete and become an ambassador by competing in the Miss Veteran America competition. And if that doesn't feature fancy, just know that this is the way you advocate. This is the way you advocate.
Yes,
you
yes,
have to
yes.
open your mouth and have those conversations. So
Yeah.
at 2 o'clock, I thank you so much for joining us, ladies. I am so honored and humbled by you being here. And I appreciate you giving of your time, your gifts, your talents, all of that. Thank you so, so much. So you all stay on. We're getting ready to sign off.
Thank you.
And we appreciate all of you for watching. Thank you for joining us.
Bye.